Hi, I'm Nina Sosa.
Hi, I'm Severino Sosa, but you can call me Tabi.
Hi, this is Lawrence, my husband.
And this is Shirley, my partner.
I spend most of my days working as a carer in an aged care facility, looking after the elderly's leisure and lifestyle.
I spend most of my days as a lab technical officer. I prepare medical machines before samples can be tested.
I work full-time as a lease administrator for IBM.
And I'm with the Aged Care Quality and Safety Commission, and I've been very busy managing the design, planning, and consolidation of our offices around the country.
My favorite isolation hobbies are going for a leisure walk around the block and listening to my favorite music.
As for me, my favorite isolation hobbies are fixing things around the house, exercising, like lifting weights, and cycling.
As I'm still working full-time, not much has changed for me. I would like to do more gardening, but with a frozen shoulder for the past 6 months, that has been difficult. Anyway, with the lockdown and having to work from home, I am able to rest my shoulder more. That is very good.
And I usually play golf on Saturdays. With the lockdown restrictions and the limit on playing groups, I have not played for 2 months now. Anyway, our daughter, Barbara, decided to give birth to our first grandchild 3 weeks ago. So any hobby we have will have to be parked for now, because both Shirley and I are being retrained by her on how to look after a newborn. Apparently, much has changed since she was born. And by the way, this was her first doll, and we will be practicing with this.
Ten years ago, when our children were very young, we were looking for a Christ-centered family church then, which is close to our area. Then my eldest brother recommended Epping Baptist Church.
I like the welcoming and the friendly environment. There are a variety of church groups that cater for different age levels and interests.
For a long time, we used to go to churches that were far from our home at Beecroft. Over 4 years ago, we thought we would explore and try out local churches in the area. EBC was our first stop in December 2015, and we have not left since. The congregation here is so welcoming, and we thank you for that.
And our intention was to find a local church that is close to home so that we can get more involved. And the closer you are to the church and its people, there is no excuse for not participating in activities. So since joining, we are engaged with our life group, with English conversation on Tuesday nights. We support dinner with friends and also has participated in other activities such as seminars.
Jesus gives me strength and assurance to carry on with my day-to-day life. He always provides my needs, and I have Jesus to trust whenever I worry about anything.
Knowing that Jesus is with me, I know that I don't need to fear anything. I know that whenever something happens to me, I will be safe in God's hands.
To me, Jesus is a close friend that I can rely on and call him at any time. He teaches me forgiveness and love. That is so important for us in any relationship, such as at home, church, or work.
And for me, Jesus has a calming effect on me, whether it is stress from work, health, relationships, financial issues, whatever. I keep referring to passages in James chapter 1, where he said to count it pure joy, that whenever we face trials of any kind, because we know that it tests our faith, and it produces perseverance and ultimately making us more mature and complete, and we will not lack anything. This is very reassuring. So finally, We thank you for the opportunity to share a bit about ourselves, and we hope to see you all soon.
Take care, keep safe, and God bless.
Bye.
Bye.
Hi Phil, welcome to Midweek Musings. It's great to have you with us all the way from South Asia.
Oh, thanks, Nath. Good to be invited. Thanks for inviting me along. So I'm Phil. I'm usually based in South Asia. I'm in Melbourne at the moment. So I've been working in South Asia with our partner organisation for about 6 or 7 years, and sort of journeying with Epping from I think most of that time. So I came and visited maybe 3 years ago. I was hoping to come visit again this month, but the virus has got in the way, unfortunately.
Yeah, well, could you give us a little taster of what the organisation does?
Yeah, sure. So we work primarily in rural areas of South Asia. It looks a lot like this in about October. Lots of rice fields. And we work mostly with rural communities, farming communities who are poor, generally women who can't read and write and don't have any of their own farming land. So generally pretty marginalised and at risk. And so we have over the past 25 years been working with these sorts of communities, helping them improve their circumstances through self-help groups. So we help about 20 women each establish a little group where they learn to read and write and about health and nutrition and hygiene and stuff like that. And then after their 8-month course is finished, they sort of start a savings group. So they save money together, and then from the little bit of capital they build up, they might take loans. And so we've been supporting that over the past a few years. And then so more recently, we've been helping those groups of 20 women link up with other similar types of groups to form a community-based organisation. So that's sort of what we've been doing, and we have some projects around vocational training, how to look after animals, how to grow little kitchen gardens, how to grow fish in ponds, and some health projects as well that support those groups and that core work that we do.
I know you're supposed to be on home assignment and with us in person in a weekend's time. Of course, that's not possible now. But how has the whole COVID-19 affected you and your home assignment period?
Yeah, it's been a bit of a challenge. As you said, like I'm supposed to have been visiting you guys in Sydney in a week or two, and I was hoping to come up to Sydney and catch up with a bunch of other friends while I was in town and people on the way. And then I was supposed to be catching up with a whole lot of other communities as well. So unfortunately, that hasn't been able to happen. And instead, I'm trying to connect with people through technology such as this. So it's been a bit of a challenge. I enjoy catching up with people, and I enjoy catching up with people in person.
Wow. So I know that the country you usually work would be struggling hugely with COVID-19. What are some of the implications for them? What would life be like in South Asia right now?
Yeah, so they're also on lockdown, much like us. I think for about maybe a month and a half they've been locked down. So most of my colleagues are stuck to an extent or based in their project offices, many of them separated from family. So that's been really stressful for them. Access to quality health care is pretty hard at the best of times, and social isolating in a country which has one of the most densely populated places on the planet is really difficult. So that's been quite a bit of stress. There is a lot of cases. Now, I can't remember, I'm not sure what it's up to now. I think last week it was 10,000 cases or something like that, but I'd assume it's closer to 15 to 20,000 now. And some of my colleagues have had relatives die recently, but they couldn't get treated at hospital who may have had COVID-19. So there's a lot of stress around that, and yeah, so I don't know. It's lockdown. They're talking about opening up in the next couple of weeks, which will be a really real challenge because they're definitely not over the hump, and the health system can't cope with the number of patients at the best of times. So how they're going to manage now is anybody's guess.
You said to me, I hope you don't mind, before we recorded, that your heart's desire would actually be to be with the people you serve. It's just a trick of circumstances that you're here and not in South Asia. But, our community is trying to support you with a health project and a travel project. What does that kind of support mean for you?
Yeah, so health is a big thing in South Asia, like having that cover. So there, as I sort of alluded to before, there are hospitals. Most of them are overwhelmed at the best of times. And there are some international level ones as well, which are quite expensive. So that health component is really important for us in providing quality health insurance and like a help number, so that if one of us ever gets sick, that we can call them up and they'll tell us what to do. So, for example, one of my colleagues got pneumonia a couple of years ago and was really, really unwell and not really sure what we should be doing and how to be treating him. And we were able to ring up the number and they told us which hospital we should go to, who to speak to. And in that case, they didn't. They managed in country, but there's also facilities to get us evacuated out if you're sick enough, which is really important. It's a confidence thing that we don't have to worry about. So I'm not particularly worried too stressed about my health because I know that these facilities are there should I need it. So that's really important. And the travel ones is sort of similar. So we have this budget for getting plane tickets so that we're not on the cheapest possible airline. And it also means that we've got enough allowance to make sure we can take stuff with us, so we're not short of stuff that we weren't able to bring because we were light on weight. So
yeah. So if we could be like praying for you, thinking of you in the weeks and months to come, are there particular things that we can be focusing on?
I think one of the main things would be colleagues and friends who are still in South Asia and all the complications with that. My brother, for example, is still there at the moment teaching at an international school. So there are still some foreign friends who are there and having to try and isolate and keep safe. And then there's my local friends who are isolated far from family, worried about their parents who are far away and unable to isolate completely. So that would be the first one. And then I guess me and my colleagues here in Australia, as we try and work out how best to get in contact or touch base and keep in contact with communities such as Epping, and how we support our colleagues back in South Asia. Being present with them so that they know that we're still here, we haven't forgotten them, and all that sort of stuff. I know this is probably a stressful time for a lot of us, and then just we're the same in the sense that there's a lot of unknown about when. Like, I don't know when I'm going to be going back. The plan was July, and the Prime Minister and people on the television are saying no international flights until Christmas. So making the most of the time we have here, and being productive and supportive as we can of our colleagues and our partners and friends in South Asia and here in Australia as well.
Well, thanks so much, Phil, for joining us.
Well, thank you for having me, Nath, and hopefully when some of the restrictions maybe are stage 3 or whatever, we'll be able to catch up again at some stage.
Yeah, thanks, mate.
No problem.